This pandemic is teaching us a lot about being flexible and adapting to new challenges. I'm so proud of Canada's efforts to date and all the creative ways people are finding to stay together while keeping apart. From this week's virtual fireworks displays to the revival of drive-in movies and concerts. While we reopen social and economic spaces, I encourage everyone to keep up the hard work of following public health advice to lower the risk for yourself and the people in your contact bubbles, especially those at higher risk of severe illness. Keeping COVID-19 under control and away from vulnerable populations is a shared responsibility of all of us. Thank you. Merci.
Bonjour.
Today, I will say a few words about the importance of individual efforts for maintaining epidemic control. But first, an update on the latest numbers for COVID-19 in Canada. There have been 104,772 cases, including 8,642 deaths. 65% of people have now recovered. Labs across Canada have tested over 2,848,000 people. Over the past week, an average of 37,000 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus. Now that summer is fully underway in Canada, and while we are learning to live with COVID-19, I want to remind Canadians of actions we can all take to reduce our own risk and help control the spread of the novel coronavirus. Individual behaviors can either help or hinder the spread of the virus. We all need to consider our own level of risk and make informed decisions. Certain groups that are at higher risk, such as seniors or those with underlying medical conditions, should take extra precautions to protect themselves. We need to be aware of the risk of COVID-19 exposure in our area and the current advice and recommendations of local public health. This also means practicing the behaviors we know will stop the spread of the virus, including physical distancing, meticulous hand hygiene, staying home and away from others if you are sick, and wearing a non-medical mask or face covering when it is difficult to keep 2 meters distance from others. Beyond these individual behaviors, we can also reduce our risk by limiting the time we spend in higher-risk environments and activities. We know from the evidence in Canada and internationally that larger gatherings and indoor settings pose a higher risk for infection. That is why I am advising Canadians to avoid the 3 C's: closed spaces with poor ventilation, crowded places with large numbers of people gathered, and thirdly, close contact, where you can't keep an optimal physical distance from others. This pandemic is teaching us a lot about being flexible and adapting to new challenges. I am so proud of Canada's efforts to date and all the creative ways people are finding to stay together while keeping apart. From this week's virtual fireworks displays to the revival of drive-in movies and concerts. While we reopen social and economic spaces, I encourage everyone to keep up the hard work of following public health advice to lower the risk for yourself and for the people in your contact bubbles, especially those at high risk of severe illness. Keeping COVID-19 under control and away from vulnerable populations is a shared responsibility of all Canadians. Thank you.
Okay, thank you, doctors. We will now open the floor to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. Operator, over to you.
Thank you. Merci. Please press star 1 if you would like to ask a question. Veuillez appuyer sur étoile 1 si vous désirez poser une question. Our first question, notre première question, nous vient de Teresa Wright with the Canadian Press. Please go ahead. À vous la parole.
Yes, thank you. My question is for Dr. Tam. The Blue Jays have permission to hold a training camp in Toronto, but they want to host games there with teams coming in and out. Is using the Rogers Centre and its hotel as a quarantine facility for U.S.-based teams playing in Toronto a solution that you'd consider acceptable?
So the key is the coordination on the ground with the local public health department as well, because they will have much more insight into the actual facilities, etc. But yes, absolutely. The idea is that any players coming in a, let's say, a cohort or a bubble quarantine situation has strict protocols to mitigate risk and not to interact or spread illness, of course, to the surrounding community. And I think that is why there's specific arrangements for their living area as well as, of course, the site of the games. So that is, those detailed plans have been reviewed by different levels of government.
It's Dr. New. Maybe I can add to that. Certainly, the plans that Dr. Tam and myself and others have reviewed have related specifically to the spring training aspect for the Blue Jays. They're based on the plans in terms of what Dr. Tam described as a tight bubble, and certainly the support of local authorities. It seems reasonable for the Blue Jays to come up here, quote, their work bubble and do their spring training. However, if you're talking about the regular season, that's a totally different ballgame, if I can use that pun. Certainly, lots to still be considered. It's not clear, at least to me, in terms of what the expectations might be for the visiting teams. You know, the players, are they allowed to live at home? What is sort of the interaction that they would have in terms of them and their families and the communities, et cetera, and of course the whole issue in terms of going back and forth across the border. So I think at this point we're just focused on, quote, the spring training for the Blue Jays, and we'll take it as it goes in terms of getting more detailed plans in terms of what they may actually anticipate for the regular season. Thank you.
Thank you, doctors. And your follow-up?
Yes, thank you. I'm wondering if either of you are aware of any cases or outbreaks of COVID-19 tied to the Black Lives Matter protests.
We are not aware of this. The local or provincial health department have not provided any kind of signal that that has occurred. That doesn't mean that we something couldn't have occurred, but we have not heard any actual reports of that happening in Canada.
Thank you, Dr. Tam. Operator, next question on the line.
Thank you. Merci. Our next question, notre prochaine question nous vient de Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Question from Catherine Lévesque from the Canadian Press. Good day to both of you. Could you speak about the United States? We know that there is a disastrous situation there. There are so many numerous cases every day. Given that many states in the United States are being forced to impose measures because of all these cases, is it really a good idea for Canada to open borders on July 21st?
Merci pour la question.
Thank you for the question. This is Dr. New. From our point of view at Health Canada, we are very closely following what is currently happening in the United States. We are listening to all experts and authorities, and authorities in the United States are also following the situation closely. Here in Canada, we can say that this is a good lesson, because what is happening in the United States really highlights something for us in Canada. We know that when we start lessening our measures, it will be very important in all provinces and territories for public health authorities to know that this reopening must be done with much caution, because we can see that the same thing could happen to us as what is happening in many states south of the border. What is going on there is very concerning to us. We always ensure to have good discussions with our provincial and territorial counterparts in public health. And I can tell you something else as well. Our policies are fully based on public health information. And we know that there is an artificial boundary between cities and rural regions. And when it comes to the borders in general, we use two principles. If the epidemiology is about the same on both sides of that border, and if the ability to track and protect and do the contact tracing to the same extent on both sides of that border, then we consider that measures could be lessened, could be relaxed for that border. And this is what I am currently witnessing as I look at what's happening in Europe. Here in Canada, we will continue to examine the science, the facts, before we give our best recommendation to the decision makers. Thank you.
Puis votre suivi?
Follow-up question. Should I therefore understand that you agree with what is being done with border opening in the European Union? And also, in most recent cases of COVID-19 in Montreal, we saw that it is the age group between 20 and 29 years of age that are most likely to transmit the virus in community transmission. I was wondering, is this a trend we are seeing across Canada? Are we currently noticing that younger people are at the source of the cases we are now seeing? Answer, Dr. New. Thank you for the question. And yes, we are always in close contact with our public health counterparts and partners in Europe and in the United States. And we are analyzing what the indicators are that would be useful to us when it comes to science and facts that would help us to take the best decisions concerning travelers and tourists. We saw that in Europe, a plan has been established to allow residents from certain countries to enter when it is considered that the virus is sufficiently well controlled in that country. That is the case in Europe. And from what I understand, that is what I understand, rather. Here in Canada, we continue to analyze data from countries around the world. There are all kinds of indicators, and this is a current issue, and we will continue to speak with our counterparts and our counterparts from provinces and territories. Now, as for what is going on in Montreal with young people, we have seen reports. The reports are more anecdotal in nature, but we've also seen some data that are indicating to us that it is possible that young people could end up with severe illness if they are infected with this virus. And there is something that is concerning. It's difficult to generalize, but if we look at youth in general, we could say that youth are perhaps taking the situation with the virus less seriously. So Dr. Tam and I and all public health officials from all provinces and territories, we always try to hammer home the point that everyone is at risk for this virus. And even if we're talking about seniors or people with underlying medical conditions, it is true that those groups are at higher risk of developing a serious illness. There are also young people who have already developed severe illness. And this is not only of concern for young people. Another important thing to keep in mind is that young people can be a vector of the virus, can pass the virus on to older people who are more at risk, their grandparents, other seniors, or perhaps their friends who have underlying medical conditions. I know it's a challenge, but it is extremely important to highlight that risks are true for everyone, and it is very important to practice good public health guidelines, which have been proven helpful to stay 2 feet apart, to ensure we wash our hands, etc.
Dr. New, next question on the line.
Thank you. Merci. Our next question. Notre prochaine question nous vient de Michel Lamarche avec TVA.
Question from Michel Lamarche from TVA. Hello. I would like to hear you speak about the possibility of a multilateral Mexico-Canada-United States summit next week in the United States. Should the Prime Minister then be submitted to a 14-day quarantine if he goes and comes back from that summit? Dr. New, I'll answer, and perhaps Dr. Tam will have something to add. I think that all Canadians understand the situation with our Prime Minister. We have a very clear guideline on the quarantine procedures. If a Canadian leaves the country, when they come back to the country, when they come back to Canada, according to our quarantine law, they must undergo 14 days of mandatory quarantine upon arrival back in Canada. It is always possible to have an exception. For example, we spoke about professional sports, such as the Blue Jays. In that case, we're looking at plans to figure out what the additional measures and additional precautions would be. This could also perhaps be applied to the Prime Minister to ensure that the risk of exposure be minimized. But in principle, all Canadians who leave the country must undergo quarantine upon arrival.
About the Prime Minister, if he was to leave the country, what would happen if he came back? And I would just say that in general, according to our Quarantine Act, all Canadians are certainly free to leave the country, but if they do come back, they're certainly subject to our Quarantine Act. And the fact right now we have a sort of sort of obligatory quarantine for 14 days upon re-entry. However, as we just talked about for professional sports, if any group of individuals or a person does maybe submit a very specific plan that would show that they were taking exceptional, extraordinary measures to minimize the risk and maybe ask for quote an exemption, and then certainly they are free to submit the plan. And I would leave to Dr. Tam to certainly consider any plan for an exemption to be looked at on a case-by-case basis. Dr. Tam?
Just to clarify, though, on the sports teams, they are in quarantine. They're just in a group quarantine, but they are actually in a modified quarantine. So that exemption is not provided so that people can just roam around Canada. This is a very, very specific plan. And in the case of the Blue Jays, as Dr. New said, for phase 1 and 2 of the training. So, yeah, I mean, the answer to the question is that all Canadians who leave and then come back are currently subject to a mandated 14-day quarantine.
Merci. Pouvez-vous suivre, Michel?
Follow-up question.
Dr. Tam, it would maybe look strange to every Canadian if the Prime Minister was coming back from Washington and didn't have to quarantine at all.
As I said, anyone coming in and Canadians coming back are subjected to a mandatory 14-day quarantine.
Thank you, Dr. Tam. So we'll now turn to the room for the next question. Mackenzie?
Hi, doctors. Mackenzie Gray from CTV. Following up on the question about Washington, there have been a number of staffers around President Trump and other people and associates who work with him who've recently tested positive for COVID-19. The advice from you and the advice that the Prime Minister has been following is to work from home as much as possible and do everything you can to avoid these face-to-face meetings. Is this something that he has discussed with your office, and do you think it is a good idea for the Prime Minister to potentially expose himself to people who have potentially recently tested positive for the virus?
I don't know the specific circumstances, no. I mean, it's not a question that I've been posed, but, my advice is the same for all Canadians in terms of reducing their risk as much as possible through all those things I've just mentioned in my opening remarks. So, yeah, absolutely. Every situation and every individual has to take into account that very specific set of personal risk assessments and minimize that risk as much as possible. And so that's not my decision to make, but this is this is the general public health advice.
Just to clarify, Dr. Chairman, you said no, you meant no, that the Prime Minister's office has not spoken to you about him going?
Correct.
Okay, so my second question is related to something Dr. Fauci said in the U.S. He said that it's unlikely that in the U.S. they'll be able to achieve herd immunity because of anti-vaxxers. It's a quote from him: general anti-science and anti-authority and anti-vax feelings amongst Americans will lead to issues around getting everyone vaccinated to a level at which the population will be able to be safe. Is that an issue that you're concerned about here in Canada?
I think even prior to COVID-19, it's been a general issue, and of course, globally. And so it's one of the top health concerns that the World Health Organization has identified. So I think it is very important for us to ensure that misinformation or disinformation is addressed right away. And actually provide information to Canadians about how COVID-19 vaccines develop. They have to go through safety and effectiveness testing and clinical trials. Accelerating those trials does not mean skimming on any safety or effectiveness assessments. And so I think that's a very critical aspect for people to understand. But I do think we probably do need to spend more time explaining to Canadians how that process actually works and provide them with the information that they need. And I think there's, the concept of vaccine hesitancy also applies to any other childhood vaccine as well. I think some children or adults may have missed some doses of the vaccines during COVID-19, given some of the public health measures and physical distancing, and that it's time to catch up with immunization because, we could well have a measles introduction or something else. And so to sort of get yourself knowledgeable, these vaccines are safe and effective. Nothing is 100% safe. There are rare side effects for any vaccine or treatment. So these need to be explained and discussed with, between the health provider and the vaccinees. But I think the, antidote to misinformation is providing, credible sources of information, which we will strive to do. But it is something that we need to plan for right now. I think ahead of any vaccine. We're not saying for sure a vaccine would be available, but that when it does, we would have prepared or pre-stockpiled approaches and preventive measures even against misinformation and disinformation. One thing that we feel is important is for everyone to actually understand where the information comes from, to ask questions about those, to get digitally educated, as well as understanding that there are information that's simply not correct and that there are bots and all sorts of things at play. So really learn how to be media and digitally literate, I think, as well as being science and vaccine literate.
It's Dr. New. Maybe I just would add to that. what Dr. Tam was saying. I think certainly the experience we had this past winter, where I think at the end of the day, I think Canadians did a great job in terms of, quote, flattening the curve and not overloading our healthcare system. And so coming into the fall, when we know we're going to go into what we call respiratory infection season, flus, and so on, I think many Canadians, hopefully, are better, aware and understanding and educated the importance of vaccination. So besides the COVID-19 vaccine, I certainly would encourage people to think very strongly about getting the flu vaccine this coming fall, so that you don't have a chance of overloading the healthcare system with both, people sick with the flu and possibly also with COVID-19.
Thank you, doctors. We'll go to the line for 2 more questions, operator.
Thank you. Merci. Our next question, notre prochaine question is from Rob Gillies with AP. Please go ahead. À vous la parole.
Hi, thanks for doing this. You mentioned the Blue Jays earlier, and you've provided an exemption for them to play training camp here in Canada, in Toronto, under a modified isolation measure. But a regular season requires a lot of back and forth travel between the United States and Canada, and visiting teams that don't have modified isolation practices in the U.S. coming to Toronto. So is a regular season exemption unlikely for Canada to give? I mean, you haven't given it yet, and the Blue Jays want an answer soon.
It's Dr. Yu. Maybe I can start, and then Dr. Tam can add as well. As we said, certainly we look very carefully at the plan that was submitted by the Blue Jays and Major League Baseball, and certainly with respect to spring training, because it is just the Blue Jays and obviously with their trainers and key personnel coming in under very strict conditions, sort of as Dr. Tam and I were mentioning, sort of a modified work bubble, quarantine, certainly limiting exposure to others, and obviously in that way there was, I think, comfort at both the local public health level as well as the provincial level, and with ourselves at the federal level, that there's really, I think, a minimal risk in terms of potential transmission to, quote, the general public, because of course, maintaining the health and safety of Canadians is the top priority from a public health perspective. With respect to the regular season, as you've pointed out correctly, that's, as I said before, a totally different ballgame. And certainly we'd have to look very carefully at what proposal would be put forward by Major League Baseball and also the Blue Jays specifically, if they were to entertain the idea, as they say, of home games and what that would mean for, quote, teams coming in, and even not for the teams, but obviously for the personnel of players, what types of precaution or preventive measures would be put in place for those players in, quote, in their home cities, especially, and as we mentioned, a lot of states that have at the present time quite high level of activity of COVID-19. Obviously, teams in California, Florida, Texas, etc. So I think, not to jump ahead, I think it's a matter of really looking very carefully at the plan that would be proposed with respect to the regular season, and then taking it from there.
There's just too much risk with the regular season plan. I mean, you're talking about multiple players, multiple staff going back from the U.S. and Canada, 3-game series here, 3-game series there. And in those cities, those American cities, they don't have isolation policies like the Blue Jays have at the hotel attached to the Rogers Center. So is it unlikely that when you're asking Canadians to quarantine for 14 days when they come into Canada, is it unlikely that you're going to provide an exemption for the regular season?
Like I say, it's early, too early for certainly myself. I would just say to start off with this, I'm a big Blue Jays fan. I love baseball, and I'm certainly looking forward, hopefully, if they can do it in a safe manner for not just the Blue Jays, for Major League Baseball to have their, I think they call it now, their shortened season. I think they're looking at 60 games or so. I was actually around in Toronto when they won their 2 World Series, so I'm dating myself. And I still remember the crazy parades up and down Yonge Street and the whole of Toronto. So looking forward to hopefully the Blue Jays going all the way way to winning the World Series. But you're right. Our priority is really safeguarding the health and safety of all Canadians. Certainly from what you pointed out, there are lots of aspects we have to look for, not in terms of just the Blue Jays, but certainly what the risk would be in terms of themselves traveling back and forth if they really were to entertain having, quote, home games at the Rogers Centre in Toronto, as well as for visiting teams crossing our border. When you look at Major League Baseball as a whole, the only thing I'll point out is that the Blue Jays are the only non-American team, the only Canadian team in Major League Baseball. And I think that needs to be part of the thinking for all of Major League Baseball in terms of how they might actually want to move forward in terms of the plans for the regular season.
Thank you, doctors. Next question on the line.
Thank you. Merci. Our next question, notre prochaine question is from Sarah Rochford with Flair Magazine. Please go ahead. À vous la parole.
Hi there. Thanks so much. This is Dr. Tam, and what I'm wondering is there any way for single people hoping to have sex this summer to do so safely?
Okay. Never got that question before. I think, again, like anything to do with social interactions in the sort of COVID era, I think do everything to reduce your risk is the key. So knowing that this virus can be quite invisible, someone could be carrying it if they are asymptomatic. I think maybe there should be a checklist somewhere. Obviously, assess your own risk. What do you have underlying medical conditions? Don't forget the risk to people that you're connected to, perhaps in your family, your parents or your grandparents who might be at higher risk. Don't date if you're sick. I think that would be important to protect everyone. And I'm not a dating expert, but let's just say, just to be sensible, maybe start virtually. And if this is a serious social contract you have with someone, where you meet them for the first time could be in a safer place, such as being outdoors, picnic in the park, I guess, separated by others. So meeting each other safely, practicing all the different hygienic measures. Small numbers of people, I mean, sort of dating large numbers and et cetera is not a wise thing. So, singular dating or smaller numbers is probably the wisest thing to do. And so, once there is people know each other more about not just your connections, but the other person's connections that could put you or your family at risk, then, of course, everyone knows COVID-19 is spread by respiratory droplets. So if you were, kissing someone, of course, this is a potential route of transmission through which you're now in a social contract, in a social bubble, for which that is, to me, I think, something to be taken seriously. And, and people practicing, I guess, relationships in as safe a way as possible. So I don't know what else to say, except carefully, slowly, like all other advice on reopening social and economic activities.
Thank you, Dr. Tam. And follow-up, Sarah?
Thank you so much. Sure. So if there were to be a checklist, would that include things like maybe trying to reduce your contact slightly with other people before you intend to go about having sex with that person, or would that not matter? Again,
given individual circumstances, you might want to take as safe a possible route as possible if that is something that two individuals want to do. Of course, all of those layers of protection can reduce risk. And so that is potential. It's a bit like a modified, cocooning yourself prior to any other intimate activity is one way of increasing safety and harm as well. And of course, don't forget all the other protective measures, condoms, everything else. Do not get too enthusiastic about thinking about COVID only. There are other very safety measures that people should take if they are dating someone.
Thank you,
Thank
doctors.
you so much.
Thank you, doctors. That concludes today's press conference.